Health officials are warning that more than 1 in 10 children starting school in England are at risk of measles because they've not been vaccinated.
The number of 5-year-olds that have had both doses of MMR that helps protect against measles, mumps and rubella has dropped to the lowest for a decade. Our health correspondent Michelle Roberts has more.
Measles is highly contagious and can cause serious and sometimes fatal illness. As well as a distinctive rash, it can lead to pneumonia and brain inflammation. Vaccination can remove almost all of this risk. But experts say since the start of the COVID pandemic, there's been a concerning drop in the numbers of children getting their protective vaccines on time. Latest figures reveal around 85.5% of 5-year-olds have had the recommended 2 doses of MMR that can protect against mumps and rubella infections as well as measles. That's the lowest for a decade and well below the 95% target recommended to stop a resurgence of measles. When a high percentage of the population is protected through vaccination, it becomes harder for the disease to pass between people. Although cases have plummeted in the last couple of years, largely due to social distancing and travel bans, the UK Health Security Agency's concerned measles could make a comeback in the unvaccinated when COVID restrictions are fully lifted.
Even a small drop in vaccine uptake can lead to outbreaks occurring. And why the focus on MMR is because measles would be the first infection we would expect to see come back. It's like the canary in the coal mine. And once we have international travel open up and COVID restrictions lifted, we expect measles to come back into this country and for it to spread in those who are not fully protected with 2 doses of the MMR vaccine.
Young children can get the MMR vaccine for free on the NHS when they turn 1, with a second dose offered at around the age of 3.5 before they start nursery or school. Unvaccinated teenagers and adults are eligible too. Michelle Roberts, BBC News.